Hey gang, and we're back here at P. Frank MD, and today we're going to talk about a question I very often get, which is, Dr. Frank, what is the best treatment for scars? And that's a difficult question because there is no best treatment for scars. All scars are not created equal, so really we have to find the right treatment for the right patient. And often the most important question is, how old is the scar? Now there used to be an old adage, plastic surgery adage, after surgery, how long should I wait until we treat a scar? And it used to say 6 months to a year, but there are a significant amount of studies, and there's very good data to show now that we do not wait. The earlier you treat the scar, the better. And the best metaphor I can give is you're redoing your apartment, something's not going right on the construction, and do you want to wait until the contractor and the team are way off premises months later, or do you want to take care of the problem right away? And the answer is you want to take the problem right away. You want to control the inflammation, you want to control the vasculature, the lymphatic drainage, and the overall healing. And there's no better way to do that than what's called pulse dye vascular technology. We use a V-beam, that's the most common device that's out there for this indication, and you really want to get on top of a fresh scar, particularly if you have a history of red raised hypertrophic scars, or in the worst case scenario, a keloid. The sooner the better. And this may be true of whether you've had surgery in a controlled incision, or whether it's traumatic in a car accident, or whether you even have red acne scars. The sooner you get on top of these scars, the better. And the V-beam is the safest, the simplest, and in the long run is going to be the least costly way to go about this. And usually we tell people, right, it's tissue removal, come on in. So this is a great prophylactic treatment. Now, as scars age, they do become different. Some people have stretch scars, white scars, divoted scars, and what you really have to do is you have to look at scars like a road that's been damaged. And some people have bumps in the road, some people have divots in the road, sometimes there are cracks in the road or the texture's gone, and this is really where the science and art of acne scar treatments are going to come into play, because again, there is no best treatment, it's the best combination of treatments for the right patient. And it is very common that we actually do have to combine treatments. It's very rare that we recommend actually cutting out an old scar, because there's tension on the wound enough. If you cut it out, you increased its risk for stretching. Even the best surgeon in the world, when they cut into skin, the overall resiliency of that tissue will never be the same. So if it's been cut or traumatized once, you really don't want to have to redo it unless you have to. So again, what are the other treatments that are out there? Obviously, this is going to depend whether it's on the face or whether it's on the body. Remember, stretch marks are also a type of scar. That's an elasticity scar that's stretching, and we have treatments for that too. Now, lasers have always been a mainstay. We talked about pulse dye lasers for red raised scars, but what if the texture is off? Fractional laser resurfacing or Fraxel laser resurfacing is still a very gold standard for scars in general. If you have a jagged surgical scar, sometimes we use fractional CO2s like the Fraxel repair. If you have mild textural type of scars, we tend to use the non-ablative fractional restore, fractional erbium type of treatments. You know, again, you have to balance the pros and cons of these things for the patient, the type of scar, also the skin type. You know, lighter skin patients may be at less risk for certain things than darker skin patients. So the choice of the device also has to do with the skin type, the age, the health status of the patient, not just the quality of the scar. But fractional resurfacing is still definitely the mainstay, and sometimes the number of treatments or the combination of lasers is going to make all the difference in the world. Something that's hot on the market right now is microneedling. We're using a lot of microneedling for patients, both energy-based and non-energy based. So you can get these type of devices in various forms. Some of them will give a certain amount of downtime, as little as a day. Others can be as much of a week. So you have to find the right type of device that is for the right patient. But microneedling is great, particularly for those darker skin patients who, you know, cannot do other types of laser treatments and are maybe looking for a more cumulative result. Divoted scars. What's very popular is the use of fillers, but the problem is that most people don't want to do temporary fillers and have to keep coming back. Not that many cosmetic dermatologists do it, but I happen to be one of the few experts in the treatment of microdroplet silicone. This is a great treatment for acne scars. It can be done in a few times. We use medical grade silicone in a very specific, slowly developmenting injection technique, and it really is beautiful for acne scars. We also use it off the face as well. There are some other fillers that are more long-lasting compared to temporary, but not as long as silicone. Bellafill is one of them, and that's certainly an option that is out there. Other types of treatments, a very popular thing that we do here in our practice is cosmetic tattooing. This is really all the rage now, particularly for white scars, because at this point, white scars are quite old. There's not that much you can do for them other cosmetic tattooing. We have our own full-time Christopher Drummond here who's amazing at that, and often he'll do that as a final step from several other techniques that we're doing. And you know, it's not that uncommon for patients. They've maybe had a V-beam session to calm down the inflammation. They've come in for a combination of Fraxel and a little filler to even out the texture and tone. They can get micro needling in a certain area. And again, this is really where the symphony, the art of putting things together to get one big result. If we had one device that accomplished everything, well, everyone would have that device. But unfortunately, with scarring of any kind on the body, that is just not the case. But we do have the tools, we do have the options, and when you do go seek out treatment for scars, you want to make sure you go to a place that has a full tool chest, because again, if you only have a hammer, everything will look like a nail. So you want to make sure that there are several options out there to either do singularly or in combination. Certainly here at P. Frank MD, we have all those options, and we try and cater to the treatments that are going to be most apropos for the patient at hand. So there are options out there. Start as early as possible and make sure you find the right combination of treatments that suit you. Thanks for tuning in, and if you want to find more information or before and afters, follow us on Instagram at Dr. Jarrod Frank and on our website, pfrankmd.com, and we will see you soon. Bye.